Do you want to see more headache and migraine patients and build a reputation as the headache guy? Hi, my name is Dr. Carlo Renato, chiropractor and PhD candidate, and it's with great excitement that NeuroLogic Education presents the upcoming seminal event of 2019, Integrative Therapies for Headache and Migraine in Sydney, March 1-3, 2019. We've assembled undoubtedly the most prominent and influential practitioners in the field of chiropractic, physiotherapy, psychology, integrative medicine, researchers and clinicians in the field. You'll hear from Professor Gwen Jull, internationally acclaimed researcher with over 300 publications, 40 book chapters and 3 textbooks talking about neuromuscular dysfunction. You'll also get to see firsthand Dr. Dean Watson, researcher and clinician of over 26,000 hours and developer of the Watson headache approach, who's successfully treated over 8,000 patients. Both Drs. Jull and Watson will be presenting an extensive session on theory, hands-on practicals, and a live headache patient assessed and treated on stage. This means that you'll see how to translate that knowledge into clinical competency and patient success. If that wasn't worth the price of admission in itself, you'll also hear from Dr. Peter Tushin, one of the most respected researchers and clinician in the field of headaches and the role of spinal manipulative therapy has in the management of headaches. You'll also get to experience a full day of integrative therapies and nutrition with chiropractor, naturopath and nutritionist Dr. Damien Christoph. A great case from Integrative GP and president of ACNM, Dr. Christabel Yeo. You'll also be one of the first to hear and see where things are heading in clinical neuroscience, neuromodulation therapies. Dr. Roberta Cho, a world-leading medical clinician and researcher in low-level laser and pain management, will be there to present. You also get to experience practical topics on transcranial stimulation and vagal stimulation. We've got a session on biopsychosocial aspects of pain and headaches. And finally, Dr. Tushin will be showing you how to take all this amazing information and start to implement it on Monday and develop a successful patient-centric business model. Over 3 days, you'll walk away with a huge arsenal of evidence-based knowledge and, most importantly, the clinical competency to manage those most challenging cases that no one else can manage. Over 22 and a half hours, you're going to add to your toolkit the following: the latest research, including spinal manipulation safety, so you can have confidence in the care you provide and ensure an effective communication with your patients and colleagues. Clinical pearls on the initial presentation, so you can target the problem with a few quick questions, triage the next steps, and be efficient with your time. Distinguish yourself from normal cervical manual therapies by learning how to desensitize or quieten down the brainstem of a primary headache sufferer by using a scientifically validated cervical intervention. We're fortunate that we're getting an insight into this, as the content has rarely been presented outside of more advanced courses. Enhancing your assessment of neuromuscular dysfunction of the neck, including neck and shoulder musculature and spinal control, which will ensure more accurate and effective treatments. How to incorporate nutrition and supplementation into your patient care, including what foods to avoid, what supplements work for headaches and migraine sufferers. More and more patients are asking about advanced neuromodulation techniques like laser, transcranial stimulation, and vagal stimulation. Don't get left behind, and make sure you hear from the leading researchers and clinicians in these areas, so you can be able to integrate these with your more chronic cases. If pain is a brain-based perception and not merely a dysfunction of muscle or joint, what else can you do to help patients in pain? Many chronic pain patients will never be resolved unless you address the biopsychosocial aspects contributing to the headaches. This is why we're including a cognitive behavior therapy session and how you can effectively include its principles into your patient care. And finally, integrating a patient-centric model of business management. Too often we attend seminars with a bunch of information, not sure how to make it work both clinically and financially. We'll break this down to the more common mistakes, what to do, what not to do in a thriving in an environment that's sometimes quite challenging. This assembly of lineup of speakers hasn't been repeated and probably unlikely to be repeated, so make sure you reserve your seat, as space is limited. The location is at Central Queensland University in Sydney, March 1, 2019. Go to www.neurologiceducation.com.au to find out the full list of speakers, topics, and to register for these very few seats that we have available. So I hope to see you there. Bye for now.